All right, and good afternoon, everyone. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, the John Philip Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 14th of December. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. So my name is Kristen Weber. I'm the Communications Manager for the Havey Institute, and I will be leading the discussion today. So Dr. Havey, good morning. Thanks for joining us.
Good morning.
We're going to dive in first here with some latest COVID statistics. There's a 43% increase over the last 14 days. Currently, there's a 17-day average of over 119,000 positive COVID cases per day. It looks like hospitalization and death rates have increased. First by hospitalization, 23%, and deaths by 32%. What can you tell us about these numbers and what we're seeing as these numbers continue to rise?
Well, obviously they're going up. And what's happening is we're so far into this wave that we're seeing not only just cases, which is over 100,000 cases a day now, all right, which is very bad, but we're seeing the hospitalizations go up and even the death rate go up. Remember, those all occur much later after the infection starts. So it just tells you how long this current wave, which is really being driven by Delta and complicated by the weather, with people coming indoors now. It's a thing we always feared about this respiratory virus, and then we had a big wave in August, in the middle of the summer. So it's just been we're learning a lot, but it's really causing havoc in many of the medical systems. There's a big surge ongoing right now in the Northeast, which has a very high vaccination rate. And then, we're going to talk about it later, but we've got the Omicron variant that's starting to spread pretty quickly in the United States.
Speaking of Omicron, I know a lot of our viewers have some questions about this variant. There's still much unknown, especially as we know that this wave is currently being driven mainly by Delta, but we know that this variant is here and there's possibly more to come. I'm going to pull up a graphic here that showcases everything we currently know about Omicron. And Dr. Murphy, I'll let you kind of lead it from here.
Yeah, no, I mean, this is just a nice summary that Sophie put together just in the last couple of days, just a general thing. We'll keep it on our website, plus it's on the video here. This was only been going on. The Omicron has only been going on since Thanksgiving. When it was first reported, it was identified first in Botswana and then South Africa, but it was sequenced in South Africa. And it was so different from all the other viruses that the WHO immediately gave it a new Greek name because it said this is just too different. There were, over 30 mutations just in spike protein alone. This has caused a lot of worry. And it looks like it's at least twice the has twice the infectious capacity compared to Delta. And Delta was already 2 or 3 times more infectious than the prior variants. So infection and risk of reinfection is much higher than the other variants, maybe as much as 5 times. And it's predicted now that this is going to become the new variant. It will take over around the world, it looks like. Now, okay, it's very infectious. It's already identified in 60 countries in 27 states, and every day there's another one that's added. And it's being spread in the community. It was originally, in the United States, found in people who had traveled or somebody who had been to a meeting where somebody else had traveled. It was brought in, but now it's really just everywhere. So in South Africa, it's pretty much taken over. They have a very low vaccination rate. Only about 30% of the population is vaccinated. And right now, they're just trying to figure out if this thing is going to work, if the vaccines that we have now are going to work. So there is new data that are out there. And it looks like the 2 doses of the Pfizer vaccine is not effective in preventing this. However, the 3 doses is effective, has, or at least has some effect. It's a reduced effect. And in one study recently, they showed that the risk for severe disease, remember, there's a couple of things we look at with the vaccines. They protect you either from infection, like you just get COVID, or they protect you from real severe disease, like you get in the hospital or you ICU on a ventilator or die. So the severe disease effect it's still there. It's about 70%. It had been 93%. So this is declining. So, alarm bells need to go off, but it's not like the vaccines don't work. And still 70% is, it's still pretty good. But we've got to be more careful, and we've got to bring other things to the table, such as wearing masks and avoiding indoor crowds. And we've got to use our other tools. There will soon be some oral medications that work. There was data recently that Pfizer, who makes the vaccine, but Pfizer also makes a drug, Paxlovid, which is a combination of their protease inhibitor against COVID, plus ritonavir, which is an AIDS drug that actually just improves the dose of the active COVID drug. That's likely to get approval soon. The Merck drug, which is only 30% effective, that's likely to get approved soon. And we got to put everything together. So our behavior, masks, vaccines with boosting now. So it's not just you got the 2 doses, but you've got to be boosted at 6 months. And that's approved. Vaccinating children more, anybody who's unvaccinated. And keep in mind now, the United States has given out 485 million doses of vaccine. So there's been a lot of vaccine distributing out there. There's still the core people that won't take it or are hesitant, but there's 485 million. We have data on 485 million people. That's really quite a bit. But this thing is so contagious. I mean, look what's happened with the Bulls recently. 10 players are out. The next 2 games have been canceled. They're postponed. They're postponed technically right now because so many of the players are out sick. So it's going to be a game changer, this Omicron thing.
Absolutely. Well, it sounds like there's a lot more to come. So we will definitely continue to discuss what we know about this variant as the weeks come.
Yeah, it's not over yet.
Not over yet. But moving forward to another latest headline, speaking of Pfizer, it looks like as though the CDC has signed off officially on the booster shots for the Pfizer vaccines for 16 and 17-year-olds. Anything you can tell us about this?
Well, Pfizer, when they did their original study, they looked at, they started at age 16. So they have a lot of experience in treating people down to 16 years of age. They treated them as adults, mostly in the United States. Pfizer is a German company, and the company that the BioNTech that developed it is a German company. They just took a different approach. When they approved the booster shot, they eliminated they only went down to 18 years of age. They wanted to keep it consistent with the Moderna and the Johnson & Johnson vaccine, or for whatever reason, but there was really actually no scientific reason. They're always concerned that young people are going to have more side effects, and we know that with these mRNA vaccines, particularly the Moderna one, that myocarditis, the side effect can happen. But there's been a recent review of that, and it's very rare. And over 76% of the cases resolve by themselves with really very little intervention. About 22% have some intervention, and then a few percent can get very sick. But it's like like just a few cases per million really get really sick. But anyway, getting COVID, of course, is even though kids tolerate it, there's over 100 kids have died, and almost over 8,000 have been hospitalized. So it's not so benign, and we don't know the long-term effects of COVID in kids. So it's always a balance, and nothing is 100%. But we've got to get immunity into all the groups that are spreading this, especially with something as contagious as Omicron.
Absolutely. Speaking of Germany, Pfizer being a Germany company, Germany locks down, has announced some restrictions and some sort of locking down on unvaccinated folks. Leaders planning to make shots compulsory to really help stop the spread. Can you tell us a little bit more about this? Some are saying extreme but necessary position.
Well, Germany is not the only country. Austria is doing the same. Other countries are starting to look at this in a very different way, because the main driver are the unvaccinated people, whether they be children who are not eligible yet to take the vaccine, or they're adults that don't want to take the vaccine. Now, as I told you, in the United States, we've got over 485 million people, 485 million doses of vaccine have been given out. So that's people who've had 1 dose, 2 doses, or 3 doses. That's a lot of experience. I'm sorry. And so the European states have a much more centralized and organized public health system. It's not like we have 50 states and the 5 territories with a lot of people in them, plus Washington, D.C. All have their own rules. In the European countries, it's basically Department of Health, the group that does the public health, and that's the way it goes for the entire country. So they're taking a very tough stance on this. There's a big anti-vaccine group there too in Europe. But they're making them pay the price of not having a vaccine, because they're putting the rest of the population so much at risk. Even the vaccinated people are getting infected, but they're getting infected at less of a rate, and they're not ending up in the hospital nearly as much as the unvaccinated ones. So that's the way they're looking at it, and I think you'll see more of that worldwide.
Interesting. We will see. Speaking of Europe, the first UK death was recorded with the Omicron variant. It looks as though in the UK right now, they're recording 20% of COVID cases are associated with the Omicron variant. Yeah. Anything you can tell us about this?
Well, this was only identified 3 weeks ago, and it's taken over 20% of all the cases in the UK. This is, it tells you how contagious this thing is. It's really no surprise that 1 death has occurred. What's surprising is that there's not more. So as we learned from South Africa, and now we're learning from Europe, and then we'll get the cases, we'll build up here, we'll learn a lot more. There is some suggestion that even in people who are unvaccinated, that this may be a slightly milder version of the disease, which would be great. However, it's so transmissible that basically everybody is going to get it, particularly if you're unvaccinated. It's just a matter of time. And then the question is, of those who get it, who's going to get sick? Who's going to get really sick and get up in the hospital? And look at these states like Michigan, and some in the Northeast now, and some in the upper Midwest. They're loaded with patients. They basically can't handle it anymore. It's becoming a crisis again, like it did at the very beginning.
It's unfortunate. Now moving into our viewer submitted questions. Our first question, we have a 76-year-old pre-diabetic individual who is on warfarin for AFib, received a booster, 50 milliliters, back in mid-October. They're inquiring about whether they should get a second booster of the same dose, or if it's advisable for some to increase and get the 100 milliliter booster to make up the difference.
Yeah, no, so this person is older, 76, mild diabetes, some cardiovascular disease with atrial fibrillation on a blood thinner, and got the booster October 14th. This should be fine for this person. The fourth dose isn't required yet. Most likely it will, but it'll be approximately 6 months from that first booster. So that would be the fourth shot recommended. There's no recommendation yet because we haven't been given the boosters long enough. But most likely when we get more data about how these antibodies are not holding up, another booster will be required. But this person doesn't have to worry about it at that particular time. The ones who should be getting an extra dose are the ones that really have trouble making antibodies. This is like organ transplant patients, a kidney transplant, lung transplant, heart transplant, that kind of stuff, where they're taking these very intense immunosuppressant drugs to keep the organs in their bodies there. They don't, or people that have hematologic malignancies like leukemia, lymphoma, multiple myeloma, those kind of diseases where they don't make the antibodies properly. Those ones should be considered for the extra dose.
Our second question, we have a viewer who is a bit cautious about getting a booster shot, having gotten tinnitus after their second Pfizer vaccine. It's been 8 months since their last shot, and they are looking to get a booster. They are wondering if one vaccine is potentially less likely to cause tinnitus. If so, is the Moderna booster shot preferred, just as it's half dose? Do you have any recommendations as to what booster shot this individual should get?
Yeah, tinnitus is a rare complication of any vaccine therapy. Could be any vaccine, really. We don't really know much about it. It should be reported on the VAERS reporting form, the Vaccine Adverse Event Reporting Form by the FDA, because there's not that much of it. So we want to see how much. So I would suggest this person and her doctor or his doctor go ahead and do that. So this person had the Pfizer vaccine. Should they switch? We're not really sure if it is the vaccine or the immunologic reaction that's causing this. Switching to a different vaccine, especially the Moderna at the half dose, is just one idea. Maybe the prophylactic prednisone, that should really be up to the doctor that's taking care of this person, and not me sitting here doing a video without knowing more about the patient or whatever. It unfortunately is a side effect that can be quite disabling. Tinnitus is not a good thing to have. It's good that they're getting better, but I would definitely do a different vaccine. So you have two choices, either the lower dose Moderna or the Johnson & Johnson. If this person is not at risk for any blood clots, if they're a woman over 50, for example, maybe the Johnson & Johnson vaccine would be considered. But this really needs to be left up to the doctor. And whether they do prednisone prophylactically, I don't know if that would be such a good idea, because it may block the response of the antibody production, which is the whole idea of taking the vaccine. So it's a tough question, but getting COVID is tough too. And the immunologic, you can get tinnitus just from having COVID. So personal decision with the doctor.
Understood. Thanks, Dr. Murphy. Our third question, do you recommend a booster if an individual has already had COVID and is also fully vaccinated? I know a lot of folks have this question. They're fully vaccinated, they had their 2 shots, but then they got sick. These breakthrough cases we're hearing about, and some folks are questioning, is a booster necessary?
Yeah, no, this question it's probably the most common question we get. And the answer is absolutely yes. What we've learned recently, as recently as yesterday, 3 papers in the New England Journal of Medicine, which is the top medical journal, one of the top medical journals in the United States, showed that the antibodies from the vaccines and from having COVID do not sustain. They do not last. All right. it's very unfortunate. They go down much faster and steeper than we thought. And from a very quick time after COVID happens or the vaccine, as early as 2 months, we knew at the beginning that people that had COVID, they didn't get reinfected like right away, but they started getting infected again at about 3 months, getting a second case of COVID. And so we knew the protection wasn't that long. And now that when we study them, the response of having, when you have COVID, it's all over the place. Some people have a really good response. Some people have a really bad response in terms of antibody production. Now, the cellular immunity, the stuff that keeps you out of the hospital and stuff, is a little bit different. That does last a little bit, that lasts longer, we know. And so that's good. But if you got, this person had the COVID and they had 2 shots, they need the booster. And the getting COVID after you have 2 shots, so breakthrough infection, we call these people hybrid people. And it's hybrid because they've had the vaccine, they have antibodies from the vaccine and they have antibodies from COVID, right? And when you give a booster on top of that, you get even a bigger response. So these people will respond very nicely to the vaccine. So if they're eligible for the vaccine and they're done with their symptoms from COVID, they should take it.
Absolutely. Our last question, we have an individual who has a 13 and 15-year-old. They were inquiring about wanting to get them a booster shot, but it's only been approved for 16 and up. They're inquiring about why the booster shot was not approved for the entire age group of 12 and up, as that age group was approved, right, and eligible for the COVID vaccine in June. And they're worried about those children adequately being protected from COVID and the Omicron variant. What can you tell us about why this booster shot has not been approved for all that were able to get the original dose?
Well, the problem is because of the side effects in kids are not as well known as in adults, and particularly this myocarditis issue. So when you look at all the cases of myocarditis, it's mostly in kids, people 16 to 29 years of age. And the lower you go in age, we don't know if it's a higher risk or if it's more serious or whatever. It doesn't seem that way, but it hasn't been studied as thoroughly. So on top of that, kids respond to vaccines really well. They have really strong immune systems. They're exposed to things all the time in the environment. And so they probably have a pretty more robust response than the adults. So with those 2 things going on, the advisory committees are just being more cautious with the kids. But I would think in a relatively short period of time, as we get more and more information, that they will approve these boosters. So I would just, at this point, just wait and see when the regulatory people feel confident enough that it's really safe to take a booster in those younger people. But I wouldn't worry about it. I mean, if they have 2 doses, they should have very good protection.
Understood. And wear masks, continue to mask up as much as possible.
Indoors. Enjoy your holiday. Test frequently. Don't forget testing frequently. And, we're going to have drugs out there very soon. That approval could be any day now for the drugs that do work against these viruses. And we now know that they work against Omicron. And so if you're a high-risk person, that's yet another option. Plus you have the monoclonal antibodies too.
Absolutely. More to come, more to come. All right, Dr. Murphy, well, that's all we have for today. Thank you so much for taking the time to answer our viewer questions and address the latest news. We'll be back on Thursday.
Okay, see you Thursday.